Welcome to Evergreen Family Medicine. We are with Dr. Racine and Dr. Clyde today as we introduce you to a new program at Evergreen Family Medicine, the Diabetes Education Program. Gentlemen, thank you for your time today.
Good to be here.
Let's start off with the reason for this new program, Dr. Clyde.
Well, we know that there's a big need in Douglas County for diabetes management, helping people manage their diabetes. And a big part of that is not just seeing your doctor, but educating yourself on diabetes and understand what it's all about. Makes it easier for an individual to take care of themselves. So I've been in Roseburg for almost 7 years, and there used to be a really great diabetes program here before I got here. But for the last several years, there hasn't been much resources for people who want to get educated about their diabetes. Diabetes is a very common disease. You know, a big percentage of people in Douglas County have it, and we want to provide the education at Evergreen Family Medicine to help patients take care of themselves, help take care of their diabetes, and help their provider help them take care of their diabetes.
Dr. Racine, it's an 8-week program. There's topics every week. What are some of the things that people will learn about?
Yeah, we've got 8 topics running every other week. We'll get into that. The first topic, actually, Dr. Clyde will be giving an introduction to what type 2 diabetes is, how it develops, and I think he'll probably get in a little bit into what it does to people. So a really good overview of type 2 diabetes. I'll be talking about how what kind of blood glucose monitoring is really useful for a person themselves or for their doctor to make use of data. We'll talk about monitoring and why and when. We'll have a session on nutrition, an entire session on nutrition and how nutrition impinges on diabetes and either makes it easier or more difficult to control. We'll have 2 sessions then about managing diabetes, one geared entirely to managing it in the absence of insulin, that is oral medicines or other drugs, and then another session on focusing on insulin and the management of diabetes. We'll have a session on diabetes complications, how they can be avoided, what complications are relevant to diabetes and how they can be avoided or maybe even improved, stabilized, or reversed. And then I think our last session will be one on entitled Living Well with Diabetes, and it'll be really a nice overview of different kind of problem solving, troubleshooting, day-to-day life issues that come up with having diabetes, type 2.
And Dr. Clyde, what's the benefit of having multiple people kind of in a community setting as they learn some of this information?
Yeah, this is one aspect of this particular education class that we really like, and it's that all these people with diabetes get to come together and not only hear it from a diabetes specialist, but also get to talk to each other. I mean, it's one thing, sitting down with your doctor and getting all these instructions about do this and don't do that, but it's another thing like meeting with someone else who is going through the same problem as you and who can relate to what you're going through and discuss, these day-to-day challenges you have in managing your diabetes. So we think being in that group and talking to others is going to be really helpful.
Terrific. You are 2 of 8 who are teaching the program.
Yeah.
Let's talk about the people delivering the information.
We'll have 4 physicians. 2 of us are endocrinologists and 2 are family doctors who have a lot of experience with diabetes. We have 2 physician's assistants who are part of the A team, really top-notch. We have a dietitian and a nurse diabetes educator also involved in not only teaching. The sessions will involve about a 30-minute time of sort of more or less instruction or teaching, and then a 60-minute time of interaction, Q&A with the presenter and time for attendees to interact with each other. We think it'll be really very helpful in the ways that Dr. Clyde has talked about.
All right. One more thing. How do people get into the program, Dr. Clyde?
So the key is to talk to your Evergreen provider. So if you tell your provider, I know, wants you to get this diabetes education, and all we need is for you to want to get that education as well. So if you talk to your Evergreen provider, they'll put in a referral. Someone will give you a phone call. You'll get registered and have all the details. And we're just really looking forward to helping people out, getting together.
Terrific. All right. Well, thank you for your time today. Dr. Racine and Dr. Clyde talking about the new diabetes education program here at Evergreen Family Medicine. Make sure to check out evergreenfamilymedicine.com online for more information, and you can follow Evergreen on the social media channels, YouTube, Facebook, Instagram, and Twitter.